All right, glad to have our next guest. Always a great intro. I'm sure. Look, this is why the bookers, the producers say they're not coming back.
They're not coming back.
You know him. You can follow him on Twitter at Rick Santorum, Senator, United States former senator. Guy right now is he's all over the television and the interwebs. Senator Santorum, thanks for being with us, sir.
Thank you, Stephen. Good to be with you for the first time, actually.
On the show, that's true. On the show, yeah. We know each other. I was just at his daughter's wedding in Ireland, and I was telling him it was wonderful. It was in a castle, and after that, nothing I've done for my wife is good enough. Thank you for that, sir. Yeah, you're just enriching one life at a time.
Set a new standard.
Yeah, exactly. We literally walk in to an old Irish castle, and I'm sitting there going, okay. I know what's gonna happen when I get home. It's gonna have an argument, and I'm like, well, you never got me an Irish castle. Oh, is that again? Okay, so you're obviously making the rounds. For people who don't know, we have this bill now. This bill, it looks like it might get passed. Republican health care bill. Graham-Cassidy. Let's put Jimmy Kimmel's comments aside for a second. Give us kind of just the summary of it for people who have no idea. How is it different from the other bills that never went through?
Yeah, it's similar in some respects and different in a major respect. It's similar in that both bills block grant Medicaid, so it takes a federal entitlement Medicaid and it puts it on it's actually called a per capita cap. What's that mean? That means that they're going to get so much money per person under Medicaid, and so it's not an open-ended entitlement anymore. In other words, we're going to give so much per person. We're not just going to reimburse whatever the state spends. So that's some limitation on the growth of Medicaid. Frankly, it's not a whole lot because we grow the cap, if you will, every year by the rate roughly of medical inflation, a little higher in the early years, at medical inflation in the later years. So what does that mean? The people who are complaining about that, and this was, again, in the other bill, so it's the same as in our bill. Yeah. The people who are complaining about are saying that this is a big cut to Medicaid. But think about this, Stephen. We're growing the Medicaid pot because, the per capita allocation for each person is going to grow at medical inflation. That's the aggregate inflation in medicine. Sure. And so what we're saying is Medicaid is now going to have to grow at that level that all medicine is growing at.
Right. Well, it's very comparable, I would say, for a lot of people, because we've talked about this in the show quite a bit, in ways to the idea of a school voucher program, where instead of just giving it into an endless supply of a public school that isn't working, you attach it to the student. And in that case, more students would go to public schools than private schools, so there would be a larger pool.
So the bottom line is, this is really the key, though. The growth rate is what people are complaining about. They're saying that's an unrealistic growth rate. But think about this. Bernie Sanders and Kamala Harris and all these people went out. Cory Booker went out last week and said, we need Medicare for everybody because it's a more efficient, and it's a better system, it's better quality, and it's lower cost. But they're complaining that Medicaid with a cap at medical inflation is going to fail. Yeah. So think about it. What's medical inflation? Well, that's the aggregate amount that everybody spends on medical care. And if Medicaid is going to fail because it can't keep up with the average, which means they're higher costs.
Right, exactly. Well, there's a lot of people don't realize fewer and fewer doctors are taking it as well. It's become a real problem. And when we talk about the people who are left in the cold because of the Affordable Care Act, there are tens of millions of Americans who can no longer afford their plans. There are millions who their plans that included Medicaid aren't taken. My in-laws, they've had a real problem with it. So I think the issue you're running into, because you're trying to make sense of the hypocrisy from Bernie Sanders, none of that is the case. It's just that it's a human right. That's the end game. So they don't want to work with you on that.
No, they don't. But that to me, that's a very reasonable way of approaching the Medicaid program. We keep that. That was in the original bill. Here's the big difference. The big difference is that's traditional Medicaid. That's Medicaid before Barack Obama expanded Medicaid. So what we do in our bill is we take the Medicaid expansion and eliminate it. We take the tax credits that are given to people on Obamacare exchanges and eliminate it. We take the cost-sharing reduction payments that are given to insurance companies to lower the cost of deductibles, and we eliminate it. We take the Medicaid, the exchanges, no longer. We take all of the regulations. We allow a lot of waivers in those regulations. So all of that is all of that is changed. Sorry about that. Obama must not have.
It's the federal government runs your electric over there. Yeah, let's give it back to the states.
Okay, so all of those things are repealed, and what's it replaced with? Well, oh, by the way, the individual mandate is repealed, and the employer mandate is repealed.
Okay.
So all of those things, basically Obamacare is repealed.
Right.
What we then do is take all the tax money that's left because Obama increased taxes, and we take that money and we divide it up to the states equally over time. Not originally, but we phase it in. But by the end of the 7 years of this block grant, every state will get the same amount per capita for the poor people they have in their state, so they can provide a innovative, state-specific, quality-driven system of health insurance and health providing for each state in America. So we get the money out of Washington, get it equally divided to the states, allow them to innovate, allow them to create high-risk pools or health savings accounts, or if they want to put, Obamacare, recreate Obamacare. I'm in California right now. If they want to recreate Obamacare in California, they can recreate Obamacare here. If they want to put back the individual mandate, they can put back the individual mandate. But every state is going to have the ability to develop their own system, and it'll be driven by two things. Number one, there's a limit. We put a cap on how much money we're going to spend. So unlike Obamacare, which is open-ended entitlement, there's a limit on how much money we're going to give the states, and they have to live within that budget. That's going to drive cost containment, which is the best way to get cost containment is improving quality. So we think we will have a lower cost, more efficient, quality-driven system in all the different states around the country.
So we know why the left opposes it. We know why Jimmy Kimmel wants to, kick your ass effectively. That's what he's going around now. Apparently he's taking out the brass knuckles for Brian Kilmeade.
Just tossing his baby at you as
he's just literally throwing. What children do we have that we can throw politically? So we know why the left is against it, but I've heard you also say, hey, listen, this is why the right needs to support it. So there's been some apprehension from more traditional conservatives. I think I know the reason, but I'd like to hear kind of what it is they've expressed to you and why they do need to get behind it at this point.
Well, Rand Paul's sort of been leading that charge, saying that we leave in 85 to 90% of the taxes that Obama levied to fund Obamacare, and we leave the spending in place. And the answer to that is we do. We do cut, although, $250 billion in taxes. We do reduce spending by $400 billion. We do get the money out to the states, and we end in federal entitlements. So, not bad.
Baby steps.
As far as I'm concerned.
Right.
But I hearken back, and this is before you were born. 20 years ago. When I was...
Well, thank you. You're far too kind. All right, I'll forgive you for the Irish castle opulence. Continue.
So 21 years ago to be exact, I was the author of a bill that passed the United States Senate and signed by President Clinton called welfare reform. And there was a guy by the name of Locke Faircloth, who was a senator from North Carolina, who voted against. He was the only Republican that voted against this bill. They got every other Republican to vote for it, 51 of them, to vote for it, because it didn't cut enough taxes and it didn't cut enough spending.
Right.
And the reason is because we spent a lot of money. And the reason we spent a lot of money in welfare was that's how we got bipartisan support. We put enough money in a block grant to the state to reform the welfare system. But here's what we did. We gave the states, the governors, the flexibility to reform the program. And guess what happened? Within 3 years, the welfare rolls were cut in half. Within 3 years, poverty hit some of the lowest rates. In fact, in the most hard-hit, impoverished, subcategories, had the best growth in income. We got more people employed who were lower income, particularly single, never married mothers, highest rates of employment ever recorded. Yeah. All because we gave the governors the flexibility and the resources to be able to get people off welfare, into work, and into productive lives.
Well, I understand, finding a middle ground compromise so that we can something is better than nothing. But I'm sure we can both agree it just takes the wrong guy down the line unless something is the dragon is cut off at the head, where you have another President Obama and people are concerned that now it's all back in play, as it often happens with government.
Here are the options. It was not coincidental that the day that Lindsey Graham and Bill Cassidy and Dean Heller and Ron Johnson and I introduced, I hung around. We were at a press conference introducing this bill. later on that day, Bernie Sanders introduced his Medicare for all.
Yeah.
And just think about the optics of this.
Well, the legal term is crazy uncle proposed a bill again. That's how it's referred to. Let's use the proper vernacular, but continue.
Medicare for all is a little catchy, though. A little easy to remember.
Yeah.
So the interesting thing about those two press conferences, they both had the same underlying point. Obamacare doesn't work. Because if Obamacare worked, Bernie wouldn't be introducing a fundamentally different way of dealing with healthcare. So now the left and the right agree. Obamacare has failed, and now the American public has their choice. They can do a plan that says 50 different healthcare systems developed at people closest at the states and people closest to the people to make more localized solutions, or one size fits all government-run healthcare by the Democrats. That's your choice, and that's the vote coming up next week.
Hold on, Gerald has a question here.
Yes,
yeah,
Senator Santorum. I feel like this is kind of like college football, where I support a team that gets beat at the last minute, and I just can't do it anymore. As a Republican, as somebody who's had his insurance go crazy, I don't know that there's just two choices in our minds right now. There are two choices, but there's this third option of like, no, you got to come up with something a little bit better. How do you get over the hurdle of communicating that this is a good path to go? Because I'm with you. I'm all for the states having the right to control this, but it doesn't seem like everybody's jumping on the bandwagon on both sides, so that, like Steven said, it doesn't just go back the next time we get somebody from another party coming in. How do you deal with that?
This is the cool thing about sending the money out to the states. Once the states have these resources and develop their own plan of how to deal with insurance markets and the pre-existing, all these things that we're going to give them the flexibility to deal with, they're never going to give this money back. They'll never let it.
You know what? That's a very good point.
Wait.
Come on, give it back, Michigan.
No.
Ain't gonna happen.
Yeah.
So this puts a stake through the heart of single payer.
Right.
That's one of the biggest selling points of this is not a single Democratic governor, if they've helped develop this system in their state, is going to say, oh, no, we'll end this and let the federal government take this from us. No way. Not going to happen.
Yeah, it really does seem like it's a battle of optics at this point. Everyone agrees. And that was one thing when Senator Santorum was running and it was down to him and Mitt Romney. I remember being on Fox News. I said, listen, this is at the time when, at this point, the Affordable Care Act is at an all-time, it's never going to be less popular than right now because there were so many problems with it. I said, what is Mitt Romney going to do? And I like Governor Romney, but he went up in that second debate and he just sidestepped it. And I remember going, this is the time to do it. So the lights just went out. See, literally, as we were are you
It's the second coming again.
He's in Utah.
Sorry.
Ron said, all right, click. All right, before we go, we just had, by the way, Clint Howard says hi. I don't know. He was on a show right before. He was in a hot tub, I presumably nude. So I don't know what that says. But he said, "I really like Senator Santorum. I met him at FOA, and I don't know if you remember him, but it's a tough mug to forget." I'm very uncomfortable with this. Okay, well, where can people read more about this bill for people who don't know? Because it's tough to kind of wade through all of the muck with this.
Well, actually, there are two good op-eds in the Wall Street Journal today that I would recommend to you that I think did a very good job. Obviously. You can go to both Senator Cassidy and Senator Graham's website that has all the details that you'd ever want to have on the bill. A lot of the myths, they posted something up just, I think, yesterday or today on all the misinformation, like, we're not covering people with pre-existing conditions, the Jimmy Kimmel test. That's garbage. Yeah. What we do is we tell the states you have to cover pre-existing condition, but we're going to give you flexibility on how you do it. Right. So there can be innovative solutions to provide better and more affordable care for those with pre-existing condition. This is the kind of stuff, for Jimmy Kimmel and for people with simple minds, and they may be the same person, that if you don't say the federal government makes you do it, then it doesn't count. Yeah. Well, you know what? There are many ways to deal with providing good quality, accessible, and affordable health care, and we want to make sure that happens and make sure everybody gets the best quality care at the best price.
I want the federal government to take over late night. And then watch. Just have Bernie Sanders will have a show.
Hasn't it already happened?
Yeah, pretty much. They go out to all the same dinners. All right, that is Senator Rick Santorum. You can follow him at Rick Santorum. I think Senator Santorum is too long for the Twitter handle, but it's too long. People won't remember. Thank you so much, Senator, for taking the time. And I hope, people let us know in the comment section what you think about this bill, where you're lining up. We always want to have our finger to the pulse and see where they are. It seems as though there's a split. So hopefully something gets done. Thank you.
Take a slice when you can get it. That's one of the things the Democrats have done all over for 40 years. They take a little bit at a time, and all of a sudden you realize what happened.
You realize the pie is rhubarb.
We want to win big or go home. Don't win big, go home. You take the first down, move the ball down the field.
There you go. Fair analogy. Senator Rick Santorum, thank you so much for taking the time, sir. There's music. That means we have to go. Oh, there